This topic is really fascinating and potentially really important in the fight against cancer because doctors and patients were constantly searching for new weapons in that fight. But now docs may have found one in your produce aisle. So the results of a University of Missouri lab study suggest that blueberry extract may kill cervical cancer cells and allow for lower levels of radiation and treatment. Using cervical cancer cells in the lab, so this is in the lab, they found that radiation alone 20% decrease in cancer cells. Blueberry extract alone, 25% decrease in cancer cells. Combining blueberry extract and radiation reduced the number of cancer cells by 70%. Fascinating research. Again, this was done in the lab, so things are very different in the human body and more studies would need to be done. But I do think it highlights, we say it on the show all the time, food is medicine, food is medicine, food is medicine. Well, in this case, it actually may end up being medicine. And I don't know how this will all play out, but we've heard about everything from resveratrol to antioxidants, and we know they can have a powerful effect in the body.
I mean, grapes and resveratrol, we've talked about. We know that it's anti-inflammatory and antioxidant properties that somehow help to prevent cancer, and in this case, sensitize the cells in some way that they respond better
to the radiation,
radiation therapy. So we mentioned in terms of prostate cancer. What do you think in terms of cervical cancer?
So yeah, approximately 13,000 American women will be diagnosed with cervical cancer this year. And a lot of those women will need radiation. And when we think about the side effects of radiation, it can be really profound. So nausea, vomiting, fatigue, vaginal pain, bladder irritation, diarrhea. I mean, the list goes on and on and on. So if we find anything that really can make those cancer cells more sensitive to the radiation, that's going to be beneficial because less radiation means fewer side effects. And that's what we want.
Well, one of the things that always got my head spinning was even back in medical school, and you would see people being treated for cancer, going through these intense regimens, and then you would see the food that would show up at their door during their treatments. And again, so much has changed in the last couple of decades, but literally the foods we used to feed patients in the hospital, I'll say poison. And so while their bodies are trying to fend off cancer, you're giving them foods that are not allowing their bodies to do their job. Because what's interesting in the fight against cancer is your body wants to play a role. And sometimes it's just a matter of turning your body's own immune system on to play a role. And I think that's where I think there's going to come a point in time where combination therapy, and not just combination chemotherapy, radiation treatment, et cetera, it's going to be combination therapy of, hey, for this particular cancer, we're going to do radiation, we're going to use these new novel drugs, and on top of it, this is the food you're going to eat. This is going to be your diet for the next 2 months because we found that, you know, this ingredient in this food does this, and I think that's where we're headed.
Well, and I think oncologists agree with you 100% that the power of food when you're dealing with cancer is so important. But in this case, these are in vitro studies. These are cells, so we have a ways to go. We still need
ways to go.
We need to do animal studies, human studies, but this is very encouraging.
Well, the good news is we always also say in medicine, do no harm, and I think animal studies are going to follow probably human trials. But I mean, this is one where if you're going to try a trial with blueberry extract,
that's pretty benign.
Probably a little better than.
It's like blueberry pie.
Yeah, like blueberry pie. But, you know, ladies, make sure you're getting your pap smears. The goal is to not get cervical cancer and to not need the blueberry extract. So if you go in for your pap smears, a lot of times we can find those precancerous cells and we can stop the cancer before it even starts. And a lot of times when you're looking at invasive cancers that are progressed, it's because a woman hasn't come in for several years to get those routine screenings. So please, please, please stay up to date because cervical cancer is not something you want, and it's not something you have to have in a lot of cases if you get those regular screenings.
And men get those prostates checked, right? Those digital rectal exams.
And last takeaway is this doesn't mean go chug blueberry extract. But obviously, hey, if you want to add berries to your diet, nothing wrong with that.